My name is LaRocca. I'm the president, CEO, and co-founder of J2 Interactive. J2 has been an InterSystems HealthShare implementation partner for 15 years, and we've been responsible for some of the largest and most highly scaled and most, I guess you would say, expansive and challenging HealthShare implementations that there are, both in the public HIE space and in the provider space when you think about health systems that are doing HIE type work in their networks as well. The reason why we love working with InterSystems, it's not just about the technology living up to all of its promise, but the fact that the organization lives up to its promise. And in partnering with InterSystems, we've been able to have some really big successes at scale for some very large health information exchanges. And two of the ones that we're talking about this year quite a bit, that have both had press releases that they've done jointly with InterSystems, would be Manifest MedX in California and the North Carolina Health Information Exchange, which is called NC Connects. With North Carolina, you're talking about an organization that is a statewide exchange serving the entire population of North Carolina. They're doing some fascinating things that they couldn't do with their prior platform. They're able to do a much more robust consent management around Part 2, for example. They're able to do some real interesting clinical event notifications that they were unable to do before as well. With Manifest MedX, you're talking about an organization that is the combination of two legacy exchanges. One of them, Cal Index, that was focused more on the payer side, and one of them being Inland Empire HIE that was more focused on the provider side. So in Manifest MedX, you have a really interesting combination of clinical data and payer data that come together to create a data set that is more complete and more robust than you would likely see at any other HIE in the country. And what HealthShare is able to do is combine that data in a way that makes it seamless and supports the kind of workflows and the kind of analysis that wouldn't otherwise be possible. And that's partly because what you get out of the box with HealthShare, but it's also partly because of the extensibility of HealthShare and our ability to extend its core data model to handle all sorts of different data types that are going to make it possible to take HealthShare and map it specifically to the needs of a particular community. We're all in on InterSystems. We're very excited about the relationship. It's one that has really driven a lot of business for us, and we like to think that our relationship with InterSystems has really helped them and helped to highlight what the technology can do. The technology is immensely powerful. We like to think that partners like J2 are able to highlight that and make it that much more accessible and help customers get a quick start on the path to making the most of everything that you can do with this incredibly powerful technology.